So Andrew, how can they make the vaccine so quickly?
So it's a good question, Dave, thanks. Actually, these vaccines have been, as you said, only around now for about 6 months. But you've got to remember that last year was a pretty strange year. All of the medical research in the world basically was diverted towards the production of these vaccines. So there's a whole lot of companies working on this, a whole lot of researchers, and there's a lot of vaccines actually that haven't succeeded, that haven't worked. So what we're actually getting is the best vaccines that have gone through all the right trials. We know that they work. The technology behind them is not actually that new. It might feel new because we haven't had these particular types of vaccines in terms of the Pfizer vaccine. It's a new technology per se, but actually the technology has been around for quite a while. And there are other vaccines that use the kind of technology that's in AstraZeneca vaccine, but we just don't need them in Australia. So that's why the vaccines can be made this quickly. Everyone's been working on them, and the technology behind the vaccine is actually not that new.
Okay, great answer. Thank you.
For a few reasons. So to protect yourself from getting really sick with COVID, the vaccine is the best way of doing that. Unless you want to be living in a wrapped up in cotton wool for the rest of your years, which I don't think any of us want to do. We want to get out and about, see our families again, catch up with everybody like we were 2019. It seems like a long time ago. The only way really of doing that is to have enough people vaccinated so that we're not at risk of having COVID spread through the community. So to protect yourself, that's the first reason, but also to protect people around you, primarily your household, your family. Not everybody will get a perfect response to the vaccine. I'm sure we'll talk about that in a little while, but because of that reason, the vaccines are not perfect. We need to have more and more people vaccinated, particularly your household, your family. If you want them to be protected, getting yourself vaccinated is also going to protect them. Particularly older people whose immune system isn't as strong as younger people. We really need the younger people to be vaccinated so that the older people, even though they're vaccinated, they've got the added protection of having their family members vaccinated too.
Great, thank you. If I have a pre-existing health condition, can I have the vaccine?
Yes, by all means, that's actually a good reason to get vaccinated as well, because if you've got a pre-existing health condition, you're more likely to get into trouble if you're unlucky enough to get COVID. So there's a very tiny number of conditions which can be an issue for the vaccines, but we're talking really, needle in a haystack kind of thing. If you've got diabetes or heart problems or lung problems, cancers, autoimmune problems, all of those are actually good reasons to get vaccinated, because your risk if you get sick with COVID is actually higher if you end up in hospital or intensive care. So again, the best protection for you if you've got a pre-existing medical problem is to get vaccinated.
Great, thank you. If I have a pre-existing health condition, will having the vaccine impact that health?
So in the first day or two after the vaccine, a lot of people will not only have a sore arm, but they might have a fever, might feel pretty tired, they might need a day off the usual work or looking after people. So take that into account, particularly if you have got a medical condition where if you get a temperature and you're feeling miserable, that might have a bigger impact on you. So you might have seen very old people overseas where they were vaccinated, someone could get into trouble, mainly because they were already so frail that getting the vaccine and even the relatively minor side effects in that situation knocked those people around a bit. But otherwise, most people are going to be fine within a day or two of getting the vaccine back to their usual activities. So take it into account. You don't want to be, for example, having to look after somebody the day after the vaccine, about a 20% chance that you might not feel up to doing that. But otherwise, after that short 1 to 2 day period, you'll be fine.
Okay, great. Does the AstraZeneca vaccine cause blood clots?
So this has obviously been a lot of the news about AstraZeneca. It's a question we get asked a lot. So there have been reports of a rare clotting syndrome with AstraZeneca vaccine, originally overseas, and we're seeing the same thing in Australia. But you've got to remember the numbers that we're seeing are extremely small. So we've given about 2 million doses now of AstraZeneca in Australia. There's been about 30 cases of this clotting condition seen. And this is really the reason why the government has made this 50-year split in terms of if you're under 50 years, you'll be offered Pfizer vaccine. If you're 50 or over, you'll be offered AstraZeneca vaccine. And that's because the risk in older people actually is lower than in younger people. So the risk that we know now from Australia, 2 million doses, the risk is about 1.6 in 100,000 people vaccinated. So that means you've got a 999,999 almost chance of not getting a clot. So really talking a very tiny number. There is a risk, yes. It's a very small risk, and the risk obviously getting COVID and having problems is going to be a lot higher than that actually.
Okay, great. How effective is the vaccine? Does it actually stop you getting COVID-19?
Yeah. So we've got more and more data that's coming from overseas where obviously there's been a lot more COVID and also high vaccination rates, particularly in the United Kingdom, the USA, Israel, for example. They've all got pretty strong vaccination rates now. So we know in those countries where people are being vaccinated, the rates of COVID have really dropped dramatically. So it's both a reduction in people getting infected, so it stops you getting infection, but it's not 100% effective at doing that. I can talk about the percentages of vaccines shortly, but it also reduces transmission. If you do get sick, you're not going to have as much virus to transfer to your household or your loved ones. So again, that's another reason to get yourself vaccinated.
Really yeah.
So you would have heard the percentages that have been originally bandied around. Pfizer was 95%, and AstraZeneca was 60-70%. And we now know in the real world situation, those numbers still come out to be about the same, but that's at preventing any symptoms at all. So that's completely no symptoms whatsoever of COVID. In terms of preventing infection with no symptoms, a bit harder to measure that because you've got to then test every single person, not because there's nothing to go on, you don't know who to test to see if they've got asymptomatic infection. But again, we know that both vaccines reduce the rate of asymptomatic infection as well. So there's AstraZeneca, we still talk around 60-70% effectiveness for not getting any symptoms at all with COVID. And Pfizer, it's come down a little bit, it's not actually quite as good as the company originally said. It's more like 85 to 90% in terms of not having any symptoms at all if you get infection with COVID.
Okay, great, thank you. Can I choose what COVID-19 vaccine I get?
So we all like to have choices in life. With this, you won't have a choice purely because the supply vaccine doesn't allow us to have that choice. So of course, in an ideal world, everybody would have the vaccine they think is the best, but actually both vaccines protect equally as well, preventing people getting really sick, needing to be hospitalised, going to intensive care with COVID. So actually, the choice is actually a bit of an artificial one. You're choosing between a really good vaccine and a really good vaccine. And there's been a lot obviously talked about with AstraZeneca and clotting, which has been a shame. You don't hear about some of the potential issues with Pfizer vaccine. It's a good marketing that the company has done actually. So in terms of choice, you actually don't need to make a choice, you just need to get vaccinated actually. Making the choice might feel like you've got some independence in that, but actually there's no need to be hung up on getting one vaccine or another.
Okay, great. How long does the COVID-19 vaccine last once I've had the second dose?
So that's a great question. We don't know the answer. The vaccines are only about 6 months old.
Yep.
So we know that they're good for at least 6 months, and they're probably going to be good for perhaps 12 months. This is obviously the study of a lot of research that's going on around the world right now. It's quite possible you would have seen perhaps in the news people are talking about getting a third dose, a booster, maybe a mixed vaccine as well, some starting off with Pfizer and getting AstraZeneca, or the other way around. We're waiting for some information from the UK actually, where there's been a study looking at that. It might be you get an even better immune response if you have a combination of vaccines. So watch that space. We don't yet know exactly how long the protection from these vaccines is going to last. Hopefully a long time. One thing with vaccines is that even though we're doing blood tests to measure how good they work, your immune system actually has a memory as well. We can't measure that memory. So we only know once someone's been re-exposed to COVID, having been vaccinated, how well that memory then protects you. So it's a complicated situation. You might have, in fact, years and years of protection with these vaccines, but at this stage it's too early to tell.
Yeah, okay, thank you. If the vaccine is safe, why can't kids have it at this point?
Sure. Well, actually, overseas kids are now getting vaccinated, so we are actually seeing in the UK and the United States of America, because we've now got some studies that have come out showing it's safe and effective in kids. Those regulatory bodies in those countries have opened up vaccine to kids. Australia hasn't gone.
Sorry, to what age group?
Down to 12 years of age.
Okay.
So there's still studies to be done in younger kids as well, which are going to be important. We're seeing outbreaks in North Melbourne right now in a primary school, grade 5. So getting younger kids vaccinated is going to be important as well. At this stage, I haven't got the information for those really young kids, but I think it's just a matter of us getting our adults vaccinated first. Those are at highest risk of getting really sick with COVID. I'm sure then Australia will be looking at vaccinating kids too.
So can the COVID-19 vaccine give you COVID?
Yeah, so none of these vaccines are live vaccines, so they can't actually, there's no live virus that's being injected. There are some live vaccines, but not for COVID. So measles, for example, chickenpox, they're live vaccines. But COVID vaccines, no, they're not live, so they can't actually give you COVID. So again, that's just another reason to get vaccinated. You'll be protected from COVID, you can't get COVID from it.
Okay. Is it compulsory to have the COVID vaccine at this point?
No, it's not. This is an option we all have, and I'd like to think that everyone would make the right choice when it comes to protecting not only yourself, but your family, the community. We're all in this together. It's not compulsory. The government might decide to change it, but I don't think that will happen anytime soon. But in the meantime, take the opportunity to get vaccinated.
Definitely. Do the current vaccines, do they work to protect the different variants that we see that are happening all around the world at the moment?
Yeah, so that's a great question, and there's a whole lot of different countries that have been labelled with variants. So now we're moving actually to labels with Greek letters. So what was the South African strain, the UK strain, the Indian strain, they're now being replaced with Delta and cant. We've seen in the news just now. We know, for example, from the UK that they've done a bit of work with Delta, which is the current, it's one of the current strains that's causing problems in Melbourne. The vaccines were just slightly less effective, and it was actually the same drop in effectiveness for both Pfizer and AstraZeneca. A small, few percentage points less effective against Delta compared to the original COVID strain. There are plenty of other strains out there, and it's hard to talk about all of them in a short period of time, but there's no one vaccine that is perfectly effective against all the variants. And also these variants, there's going to be more variants that come out as well. It's just the nature of the virus. And almost certainly we're going to have new vaccines to deal with these variants. And that might be the strategy we go with next year. For example, a booster that covers whatever variants are around. A bit like the flu shot actually, which will change every year to cover whatever strains we're seeing in the Northern Hemisphere. That's how we choose the Southern Hemisphere flu vaccine. So it's probably going to be a similar situation with COVID vaccines, I think.